All right, so a question that came in was about neuromas. What is this deal about neuromas? A neuroma is a thickening of the nerve between metatarsal bones. These are if this was the metatarsal bones they were talking about, the most common place where a neuroma will form, or a thickening of that nerve, will be between the third and the fourth metatarsal heads. And just because of anatomy, how nerves come together to innervate the digits, that is a very common place for that thickening to occur. One of the common things or misunderstandings that happen with neuromas, though, is that because it has OMA at the end of the word neuroma, the concern is this cancer? And it's not. A neuroma, or OMA, is just, again, like I said, a thickening of the nerve. And with pressure coming off of that nerve, what will end up happening as a result is the decrease then of the nerve. The thickening will go away over time if it's treated right. And what's some common things that this can be confused with? Certainly, there's pain across all of the metatarsals. That can be considered metatarsalgia or capsulitis, or where there is inflammation across one or more joints. That can be confused for a neuroma. But what you want to know is how we usually take care of this. And the good news is this can be done mostly conservatively. Very rarely do we have to take patients to surgery unless conservative efforts have failed. And so what we do is using something called a metatarsal pad to offload the area, or we can use a special insert called an orthotic. This is a device that we can stick in the shoe, and in addition to a metatarsal pad to remove pressure from that area, it can also help to decrease the pressure and therefore decrease the thickened area of that nerve and get that back to a normal place. Sometimes we have to do injections. Sometimes we have to do surgery. But for the most part, this can be taken care of conservatively. And all of the podiatrists here at Pueblo Ankle and Foot Care, all the foot and ankle specialists here, are very skilled at taking care of this. We also have in-office x-ray, and that is something that we also would do. Sometimes we can see on the x-ray if there is that thickening there that's causing those metatarsals to splay. And so we can do that also here in our office on site.